Hello, good morning. Thank you for attending today's webinar, which is brought to you by the American Institute for Cancer Research. Today's webinar is titled Behind the Updated Label with the FDA, Nutrition Facts for Health and Cancer Prevention. My name is Sheena Swanner, Director of Nutrition Programs here at the American Institute for Cancer Research, and I'll be moderating today's presentation. First, I'd like to begin with some technical housekeeping items. At the bottom of your screen, there's an application widget. If you have any questions, please submit them through the Q&A widget at any time. At the end of the presentation, we'll get to as many questions as we can. If you have any technical issues, please let us know through the Q&A widget as well. After the webinar, you will be receiving an email with a link to a survey along with your CPEU certificate. You will earn 1 CPE hour for today's webinar. Today's 3 presenters from the FDA are Dr. Claudine Cavanaugh, Senior Advisor for Nutrition and Policy, Dr. Maya Maroto, Public Health Educator, and Dr. Robin McKinnon, Senior Advisor for Nutrition and Policy. So let's get started. My role here at AICR is to help put cancer prevention into action. I'm excited to work with the FDA and provide information on the updated nutrition facts label and specifically speak to how the nutrition facts label is essential when looking at chronic disease and cancer prevention and survivorship. First, I'd like to review some background on AICR for those who may not be familiar with our organization. AICR funds cutting-edge research and gives people practical tools and information to help them prevent and survive cancer. We recently published our 3rd expert report in 2018, which has the latest research on how lifestyle factors such as diet, nutrition, body weight, and physical activity can impact cancer risk. Specifically, the 3rd expert report highlights 10 recommendations for cancer prevention. Essentially, we translate extensive research and in turn provide a blueprint to help beat cancer. You can access the 3rd expert report and other great resources on our website, so be sure to check that out. When talking to clients and patients, it's imperative to connect chronic disease prevention and the nutrition facts label. It's estimated 40% of all cancer cases can be prevented. That number is huge. Eating a healthy diet, being more active, and maintaining a healthy weight are, after not smoking, the most important ways to reduce cancer risk. It's important to know what's in your food to help with cancer prevention. On this slide, you'll see AICR's 10 recommendations for cancer prevention. I have starred 6 out of the 10 recommendations, which focus on food and healthy weight. The new nutrition facts label is a great resource to use alongside these recommendations, specifically when talking to patients and clients. Specifically, you can focus on limiting foods high in sugar, eating more and enough fiber, and looking at calories and serving sizes and sodium intake. Those are some key areas to focus on. Before I hand it over, I'd like to note that AICR has been engaged in policy work, including advocating for changes in the nutrition labeling that makes it easier for people to make healthy choices that can help reduce their cancer risk. Updates to the nutrition facts label and menu labeling in restaurants are certain policies that we have been excited to work on to support the FDA. I will now hand it over. The FDA will be digging deep into the updated nutrition facts label and discussion on menu labeling. It's my pleasure to introduce Dr. Robin McKinnon, Senior Advisor for Nutrition and Policy.
Great, and thank you so much, Sheena, and all the team at AICR for the invitation to join today and the opportunity. So briefly, as Sheena mentioned, I'm Robin McKinnon. I'm a Senior Advisor for Nutrition Policy at FDA's Center for Food Safety and Applied Nutrition, or CFSAN. But prior to joining FDA, I was actually at the National Cancer Institute at NIH for over 10 years. And my responsibilities there, I worked on policy research related to nutrition, obesity, and physical activity. And I'm joined by Dr. Claudine Kavanagh, who's the director of the Office of Nutrition and Food Labeling here at CFSAN, has been with FDA for a number of years and has been leading the FDA's Nutrition Innovation Strategy that we'll touch on briefly. Also menu labeling and the updated nutrition facts label rules. And before joining FDA, Dr. Kavanagh was also a cancer prevention fellow at the National Cancer Institute. And I'm also joined by Dr. Maya Moroto, who's a public health educator at FDA's CFSAN. And Dr. Moroto works on developing, implementing, and evaluating consumer nutrition and food safety education initiatives here at FDA. And before joining FDA, she worked on nutrition education projects at USDA, the Food and Nutrition Service. And both Dr. Kavanagh and Dr. Moroto are both registered dietitians. So let's move along. And I'm advancing the slides here, but briefly, in terms of the learning objectives, we're hoping at the end of the session that you'll be able to understand how the new nutrition facts label fits into the broader FDA plan for improving nutrition, help identify the changes to the nutrition facts label, and also explain how those elements have been updated and reflect new public health and scientific information. And finally, be able to discuss ways that both consumers and health educators can engage with our education and outreach efforts to help promote the use of the nutrition facts label and also broadly help support healthier eating. Just briefly, and I will provide a little bit of background here first on FDA, our roles and responsibilities, work in this area, and the link to health outcomes and cancer and specifically. Then I'll hand over to Dr. Kavanagh, who will talk about the Nutrition Innovation Strategy and the changes to the Nutrition Facts label. And then Maya is going to talk more about the education initiatives that we have related to the Nutrition Facts label and also menu labeling a little bit as well. So very briefly, our food responsibilities. About 20 cents of every consumer dollar in the U.S. is spent on FDA-regulated products, and the vast majority of that is on food products. And the FDA regulate the safety and the labeling of about 75% of all food consumed in the U.S. And of course, we work in close collaboration with our federal partners on that effort, with USDA, with CDC, with the National Institutes of Health, and many others. And overall, you can see we're, as a nation, not adhering to dietary guidance. What you can see here is an image from the Dietary Guidelines for Americans from 2015-2020. And in the orange bars, you'll see where we're not meeting recommendations. The blue bars are where we are. And you can see we're under-consuming vegetables, fruits, dairy, major food groups there are under-consuming, and relatively small percentages meeting the recommendations. And in contrast, we're over-consuming nutrients like added sugars, saturated fat, and sodium. And that's really important because the link between poor diet quality and health outcomes is an important one. And there's this strong link, and I wanted to walk through that link between poor diet quality and negative health outcomes here with this slide. And we're looking at the related, the top risk factors in the U.S. and the link to health outcomes here. So I'll just highlight a few things. These are the leading risk factors. So you see dietary risk, tobacco use, etc. And then the health outcomes, so you can see here the communicable diseases, non-communicable diseases, and also injuries related to those risk factors. And you'll see particularly the non-communicable diseases associated with the risk factors. In the purple lavender color, that's diabetes. The mid-blue is cardiovascular disease, and the lighter blue are cancer outcomes. And then, so at the top here are the risk factors related to mortality, and at the bottom the risk factors related to morbidity or disability adjusted life years. And then finally, the boxes that I've highlighted here are the risk factors associated with poor nutrition. And you see here this incredible burden of nutrition-related chronic disease. Now, before I wanted to bring this down to more of a link from this high level to nutrition and cancer, and this is kind of an introduction to the next slide that I want to talk about dietary patterns and diet quality, but just kind of at a very high level, stepping through one of the indexes, one of the indices to assess dietary quality, and this is the Healthy Eating Index 2015. Of course, if people want more information, please go to the work from Dr. Sue Krebs-Smith in 2018. And of course, Dr. Krebs-Smith and many others were leaders and lead this effort on Healthy Eating Index and from the National Cancer Institute as well. But you see here the components of the Healthy Eating Index. So this is, again, a way to assess overall diet quality. You see the different components, fruit, total fruit, whole fruit, etc. And then the different ways of scoring how to assess the different components here. So there's a maximum and a score of 0 from the different components. So with this, you can see, for instance, with total fruit, if you get a maximum score, if you eat at least 0.8 of a cup equivalent per 1,000 calories, and get no points if you consume no total fruit at all. And then for each of the components, they're assigned the maximum points there. Would be 5 for total fruit, and all this adds up to 100. So you might see the overall index be a number out of 100. So there are several different ways of assessing these dietary quality methods. And this slide then links the diet quality, several different kinds of dietary quality indices with reduced mortality outcomes. And there are several very large cohorts that have been in place, and we've been analyzing the diet quality for, or groups have been monitoring the diet quality for these very large cohorts. And what people have found, what researchers have found, looking at the assessment of the dietary quality using a number of the different indices, like the Healthy Eating Index that I was in the slide before, but other methods like the Healthy Eating Index from 2010 or the Adjusted Healthy Eating Index. So the different types of indices for assessing dietary quality, and then down the bottom, looking at these at the diet quality associated with the different cohorts. And what this slide is showing is the protective effect of the highest quintile of these large cohorts. So if you have a high diet quality, that is protective for all-cause mortality, for cardiovascular disease mortality, and also cancer mortality. Now, that's overall. Of course, I want to highlight the work of AICR and the expert report from 2018, looking at individual nutrients, food group, more detailed assessment of individual consumption of diet, and specific cancer outcomes. So there's not time in this presentation to go into all of those links, but want to point people there for more specific information on the link between certain nutrients and patterns and cancer outcomes. Now that's nutrition and cancer outcomes. Of course, diet is related to increased risk for overweight and obesity, and there is there's strong evidence of the link between overweight and obesity and certain cancer outcomes. So this is information from the National Cancer Institute. I won't go through all of this information, but know that there's strong evidence of the link between these overweight and obesity, which is linked to diet quality, and certain cancer outcomes such as kidney disease, kidney cancer, and cancers of the endometrium, liver, gallbladder, postmenopausal breast cancer, etc. And some of the mechanisms are, the potential mechanisms are listed here. And we know, for instance, that people with obesity have chronic low-level inflammation, which over time can cause DNA damage that leads to cancer outcomes, and that adipose tissue produces excess amounts of estrogen, and high levels of those have been associated with increased risk for breast, endometrial, ovarian, and other cancers. So there's this link between nutrition and negative health outcomes, and specifically between diet, obesity, and cancer outcomes as well. And so given those links between poor diet and negative health outcomes, including generally with chronic disease and also cancer outcomes, and given our role as FDA as a public health agency and charged with the health and safety of the food supply, we have a number of tools that we have at our disposal to help support Americans make healthier dietary choices. And so that is presented here in this conceptual framework, where we base the information on robust science, whether it's etiologic, surveillance data, and then bring our tools to bear on that scientific evidence. And so those types of tools may be regulations or guidance documents, working with stakeholders, and to work directly with consumers, or also sometimes directly with food manufacturers to help improve public health outcomes. And of course, that's an iterative process. Just one example of that change, bringing our tools to bear, it's on the change that we made on the nutrition facts label with trans fats that was required on the nutrition facts label in 2006. And so with requiring that link on, or that information on the nutrition facts label, reduced consumption of trans fats by about 80% in the country. And then since we've revoked the generally recognized as safe designation for artificial trans fats, so partially hydrogenated oils, and so they've been phased out of the food supply, and researchers have estimated that will avert tens of thousands of cases of cardiovascular disease. So that's just one example of the power of the tools that we have at our disposal. And so with that, I'm going to hand over now to Dr. Claudine Kavanagh, who's going to talk about the Nutrition Innovation Strategy and also the updates to the Nutrition Facts label.
Hi, thank you very much, Robin and Sheena. I really appreciate being here. So I'm going to talk very briefly about FDA's Nutrition Innovation Strategy. The goal is to, as Dr. McKinnon referenced, is to reduce the burden of chronic disease through improved nutrition. And we want to do that through empowering consumers with more information and facilitating industry innovation towards healthier food. And Robin gave you the example of how we kind of did that through labeling, and the labeling actually had the industry, they didn't want it on the label, so they reformulated their food. So it was kind of a double win, and used both tools. So there are several different key elements that we have for the Nutrition Innovation Strategy, but I'm really going to be focusing on implementing the menu labeling and the nutrition facts label, and particularly the nutrition facts label. So the nutrition facts label, you should be able to see it on a lot of products out in the stores. If you go to the grocery store, it's on a lot of products now. There is definitely kind of a cycle. You know, there are foods on the store shelves that have to be taken off. So you'll see it more and more, but a lot of manufacturers have switched over, and the large ones had to as of January 1st, 2020, and smaller manufacturers have another year. So there will be a time where you will see the new label as well as the old label. We've had to issue many types of guidance documents to help the industry implement. We published these rules back in 2016, but this is a big change for a lot of the industry, so it was really important to give them enough time to do that. And then we've also announced the launch of a major educational campaign surrounding the new nutrition information that you're seeing, because we haven't really had a major update in the label for over 20 years. So this is really an opportune time to really get people reacquainted with the nutrition facts label. So now I'm just showing you a side-by-side comparison of the original label and the new label. We wanted to make sure that we kept the iconic nature of how the nutrition facts label looks. And I think we've done that, but we did want to kind of modernize it and give it an updated view. And you can probably definitely see that we've highlighted calories, made the serving size information a little bit bolder and easier to read. And my next slide is going to actually show you some of the changes that we've done. So as I said, you can definitely see calories are a lot larger type and bolder, as well as the serving size. And part of that was, if you think about when you go to the grocery store, you're usually kind of in a hurry. You may or may not have children with you. So if you are trying to look at the nutrition facts label, we wanted to make it very easy so people could spot the calories and the serving size information right away, and they didn't have to, really stop and put their reading glasses on and things like that to notice that. Some of the other things that have been updated on the label that people may not notice right away are the daily values, and I'm going to go through those in a few more slides. We've added changed the nutrients that are required at the bottom portion of the label, and actually also included the amounts of those nutrients. We've added sugars, and we've also updated the footnote to try and better explain the daily value. So I'm going to go through all of these changes for you. So for calories and serving size, again, they were updated to really address the issue of public health and the obesity, so people could definitely identify that. And again, easy in a fast-paced environment when you're going to the grocery store. We also reversed the order of serving sizes and servings per container, because from calories below, all that nutrition information is based on the serving size. So it kind of made sense to reverse the order. For dietary fiber, this is an area that you probably won't necessarily notice a difference if you weren't at this webinar today. But we've actually updated the definition of dietary fiber for the nutrition facts label. So any fiber that's intact and intrinsic to plants would be included as dietary fiber. However, since the 90s when we had the original label, a lot of fibers are isolated or even synthetic, and they add those to foods. So we wanted to make sure that the fibers that they're adding actually have some kind of physiological effect and benefit to human health. So we wanted to make sure that the industry isn't just adding fiber to get, increase the daily value, that it actually has a beneficial effect. So the new definition of dietary fiber really aligns with the National Academies of Science. And again, all the fiber in the food now has to have some kind of beneficial effect, whether it's lowering your cholesterol levels, improving laxation, something like that. So we are evaluating that for all isolated and synthetic fibers. One of the biggest things that I think people have seen, have noticed on the nutrition facts label, is the addition of added sugars. So in addition to adding added sugars, we changed sugars to total sugars, so people knew added sugars as a subcomponent. We've also added sugars includes any sugars that are either added during processing or packaged as such. And packaged as such means things like honey, your 4-pound bag of sugar that you would buy in the grocery store. So kind of individually packaged sugars. And the slide gives you some examples of everything that would be considered added sugar. So it's things that you would expect, like just sucrose, brown sugar, high fructose corn syrup, but maybe some things you didn't expect, like concentrated fruit juice, or kind of honey or molasses. A lot of people, when I've talked to them about the new label, they don't understand that sometimes those are kind of the hidden sugars. We do have one exception, though. As part of the Agriculture and Improvement Act of 2018, which is commonly known as the Farm Bill, it said the nutrition facts label cannot require the declaration of added sugars for single ingredient sugars such as honey, agave syrups, and maple syrup. So single ingredient foods will have the daily value for added sugars, as you can see on the slide on the nutrition facts label on the right. So they still have the daily value, but it doesn't have to have the includes X gram of added sugars. And some of that was related to some concerns around that for like honey or maple syrup, that language might have consumers think those products were adulterated. But we're following the law, and those are, though, if they don't have to have the includes X grams of added sugars, but we're recommending that they include a footnote at the bottom of the label, which is on the right, that explains what the added sugars daily value adds. And this is a point where I think a lot of dietitians could definitely help by, when they're educating people, how the added sugars will look different on foods that have added sugars and these single ingredients products. We've also updated the daily values for many of the nutrients. And again, this is something that probably the casual consumer at the store isn't going to realize, that these numbers have been updated, but we're using the most recent science, and we've changed the daily values to have the latest science. And a lot of these are based on the dietary reference intake reports that the National Academies of Science have put out since the early 2000s, and there's even been recent reports of sodium just had a recent report, and in 2016 I think the vitamin D was updated. So all of those are kind of included in that. And you can see there's been some changes in total fat and total carbohydrates. Dietary fiber has increased, a decrease from the original label in sodium. Potassium has increased, calcium has increased, and then we've also changed vitamin D. It's increased, but it's also changed the units. The National Academies of Science recommended that we don't use international units anymore, and that we use micrograms. We've also altered the nutrients of public health significance. Those are the 4 nutrients that are required at the bottom of the label and highlighted with the red box. The original label included vitamins A, C, calcium, and iron, but we really found that now vitamin A and vitamin C aren't really associated with any chronic diseases, and they're really, well, they may be shortfall nutrients. There really aren't people that have like scurvy and things like that anymore. But we did add vitamin D and potassium, and part of that is those are nutrients that people are not getting enough of, and they're also associated with chronic disease. Potassium can reduce your risk of hypertension, and vitamin D is associated with osteoporosis. And then one thing that we actually got back that we also added is the absolute amounts of the vitamin. On the original label, if you go back and look, the actual microgram or milligram amounts of the nutrients for those nutrients of public health significance aren't listed. But some of the feedback we had when we issued the rules were specifically from health educators, and they said, you know, and they said that if we recommend that women get 1,300 milligrams of calcium a day, and you just have the daily value, people have to do a lot of math to figure that out. And that's really hard. If you have the absolute amount, as they look at the nutrition facts label and all the foods they eat in a day, they'd be able to easily add that up. So that was actually some helpful feedback that we got from some health professionals in the rule, from the proposed rule, and that we finalized in the rule. So really giving FDA feedback. This is an example of how it can affect the label. We also made another change, and we removed calories from fat. from the original label. And part of that was when the label was originally done in the early 90s, fat was really stressed, and really all fat was considered bad at that time. Now that science has kind of evolved over the last 20 to 25 years, we found that it's really the type of fat that people are more focused on and not fat as a total. So we still have saturated fat and trans fat, and as well as total fat on the label. We just didn't feel, based on the new science, that calories from fat was really needed at this time. We've also updated the footnote at the bottom of the label, and the footnote is to explain basically the % daily value and put the number of calories that you kind of need in a day, kind of give people a little bit of a focus, because we've actually found a lot of people don't know how many calories they need in a day. So putting the 2,000 calories is a day as general nutrition advice at least gives people a ballpark. And that's actually consistent with some language that we have in menu labeling that's required on menus. We also want people to kind of know what the daily value means. So it tells them how much of the nutrient of the serving that it's contributing, that people are kind of trying for some nutrients like sodium, they want to stay below that 100% threshold. For things like vitamin D and calcium, they want to get at least 100%. So it tells people, gives them kind of a ballpark number. And we found in our research that the daily value is something that people kind of have a hard time to understand. So I think this is an area that's really ripe for dietitians and nutritionists to talk about when they're counseling their patients on the nutrition facts label. Then the serving size on the label have also been updated for different types of foods. So the Nutrition Labeling and Education Act, which actually authorizes FDA to have the nutrition facts label, says that we have to base reference amounts customarily consumed, which are what we calculate serving sizes on, that they're required on the nutrition facts label, and they have to be calculated on what people are actually eating, not on recommendations. I always hear from people, oh, it should be what's recommended. One thing that I tell people a lot with that, for some foods you really don't have recommended amounts. For like candy and soda, we don't really recommend that people have certain amounts of that. That's kind of considered more of a treat or discretionary calories. So that recommended works for things like fruits and vegetables, but not for everything that has to be labeled. So this kind of makes sense when you put it into that context. About 30 of our racks were changed, and we have about 158 categories. Probably the biggest ones we have are carbonated beverages went from 8 ounces to 12 ounces. One of the few that actually went down is yogurt. It went from 8 ounces to 6 ounces. And I have another serving size change in this slide, and this is for ice cream. So this one probably doesn't surprise people. So if you think about a pint of ice cream that you would get at the store, for the old label, it would have been considered 4 servings. Now with the updated label, people are eating more ice cream. That's what we found from looking at the surveys. So it's actually 3 servings per pint. And this kind of makes sense, because usually if you get a pint of, chocolate ice cream, it's hard to only eat 1/4 of it. So that kind of makes sense. We have also changed the labeling of single serving packages. So some things like a 20-ounce soda that you might buy at a convenience store, that used to have the option of being labeled as more than 1 serving. But we found, and we actually did consumer research, and found that people, when they looked at the calorie information, didn't realize that was more than 1 serving. They figured a typical person is going to drink the whole 20 ounces of that. So they would see that information and not realize it was more than 1 serving, and really be miscalculating the amount of calories that they're getting. So we changed our regulations, so things that can be, that are less than basically 2 servings has to be labeled as a single serving. And another thing that we did to actually kind of help people with the calorie calculations, on certain packages we're requiring dual column labeling. So these are for packages where it's over 2 servings, between kind of 2 and 3 servings, and for these types of packages they have to have a per serving as well as a per container. I can give an example with if we go back to the pint of ice cream. Now that the pint of ice cream has 3 servings in it, a lot of those would have to be labeled per serving and per container. So if people are just going to have the 2/3 of a cup of the ice cream, that would be labeled. If people are going to eat the whole carton of ice cream, they will have that information. And it really takes it away from people not having to do the math. Another example of a product that would have dual column labeling would be like a 3-ounce bag of chips that you might get at like a convenience store or something. It has to be labeled both ways. And I think that's very helpful because some people may only eat half of it and save it for later or share it with a friend, and others are going to eat the whole thing. And the information is all there, the math's already done, and they have the information they need to make the food choices. So now I'm going to turn the presentation over to Dr. Maroto that's going to talk about the Nutrition Facts Consumer Education Campaign. Here, Maya.
All right. Thanks so much, Claudine and Robin and Sheena, for that great introduction. So again, my name is Maya Maroto, and I'm a public health educator at FDA Center for Food Safety and Applied Nutrition. And as you can see from Claudine's presentation, there are a lot of changes to the label. And we know from our focus group research that when consumers hear that there's a new label and there are changes, they get really interested to know more about those changes. So we're working on a consumer education campaign on the new Nutrition Facts label as a key part of the nutrition innovation strategy that Claudine introduced. So in the coming months, we'll be launching this campaign to raise awareness and understanding of the updated label. We are prioritizing shoppers, especially those at higher risk for nutrition-related chronic disease. We'll be working to reach consumers directly and through healthcare professionals, dietitians, teachers, and health educators, like those of you on the call today. So we hope you'll use our current and future resources on the Nutrition Facts label with your clients, patients, and students. The priority education topics are really centered around the areas of the label that changed that Claudine went over, such as calories, serving size, percent daily value, and added sugars as an important component within the context of the entire label. And I'm trying to advance the slide. Oh, there we go. Thank you. So one message that has not changed and has always been something that FDA has emphasized since the original label came out in the 90s is the 520 daily value guideline. So we encourage you, I don't know why I'm having trouble with these things. We encourage you to continue to communicate that if the percent DV for a nutrient is 5% or less, the food is low in that nutrient. And if the DV is 20% or more, the food is considered to be high in that nutrient. In accordance with the most recent dietary guidelines for Americans, consumers are encouraged to more often choose foods with lower percent DV for saturated fat, sodium, and added sugars, and with higher percent DV for dietary fiber, vitamin D, calcium, iron, and potassium. So right now, if you're looking for a one-page overview, sort of in a nutshell of what Claudine presented, the changes to the label, you can download this piece from our website, and we hope this would help you go over those changes with your clients or patients or the audiences that you work with. So the website that I'm referencing for that piece and many others is fda.gov/nutrition education. And I encourage you to visit that website and also check back often. It's constantly changing as we are adding materials on the new nutrition facts label all the time. But right now we have materials for tweens and adults. We have a middle and high school curriculum called Science in Our Food Supply to help teach the nutrition facts label and menu labeling. We also have a continuing medical education video on the nutrition facts label. I also really encourage you all to sign up for our News for Educator newsletter on this website. So if you go to the site, right at the top there's a little link that says sign up, and you will get emails so that you'll stay in the loop when we post new resources or release new materials. I did want to go in depth to talk about a couple of our education materials that are available right now and that can help you teach the new nutrition facts label. So the first one I'll talk about is Read the Label, which is a resource for tweens ages 9 to 13, their families or community leaders. It includes worksheets, games, tip sheets, and lots more. It's really designed to make it easy and fun for anyone who works with or is raising tweens to teach the nutrition facts label. And this resource is fully available in both English and Spanish. I wanted to also highlight a new resource called the Health Educator's Nutrition Toolkit, Setting the Table for Healthy Eating, which is for health educators who work with adult audiences. And it's designed to encourage healthier choices in the grocery store, when dining out, and also at home. This resource includes a ready-made PowerPoint presentation complete with speaker notes, handouts, tip sheets, pre- and post-test, really everything you would need to run a session or a series of sessions to teach the nutrition facts label and also healthy choices in other situations like eating out and at home. And this resource was tested with health educators and was refined based on their feedback to be an even more user-friendly resource to help teach the label. So I'm going to switch gears a little bit because nutrition facts label, as Claudine and Robin mentioned, is not the only major nutrition policy that's been implemented in the past few years. So menu labeling, commonly referred to as calories on the menu, is another recent regulatory change that consumers are seeing when eating out at chain restaurants and eating establishments. And menu labeling has created a uniform standard for listing calories on menus and menu boards at restaurants and retail establishments with 20 or more locations. So to talk a little bit about what's required with menu labeling, restaurants are required to list the calorie information for standard items on menu boards or on signs adjacent to foods. They're also required to include a succinct statement that 2,000 calories a day is for general nutrition advice, but calorie needs may vary, and also a statement notifying consumers that additional nutrition information is available upon request. And so if you're not familiar with what that additional information is, these are the nutrients that are required to be provided if any customers ask for them: total calories, total fat, saturated fat, trans fat, cholesterol, sodium, total carbohydrates, fiber, sugars, and protein. So consumers can get not just calories, but all of these nutrient information at chain restaurants with at least 20 locations. So in that vein, here are some screenshots of our consumer materials meant to break down this new calorie labeling that people are seeing. And we framed our resources, which are, again, based on consumer research, around 3 steps to making healthy and delicious dining out choices. So the first step is find out your calorie needs, and we have resources available to help people figure out what their calorie needs are so that they can put the information that they're seeing in the marketplace in context for themselves. The second step is to look for calorie and nutrition information. And then the third, make the best choice for you. So we framed our resources around messages that consumers in our testing found to be empowering and positive rather than those that had a more sort of preachy tone. So we did testing and we tried to go with those most motivating messages that we found. So our website on menu labeling, which features our education materials and also a social media toolkit, is fda.gov/calories on the menu. And we've included some screenshots of that website, so you can feel free to use any of these graphics or web badges or social media messages in your outreach and communication related to making healthier choices when dining out. So I want to wrap up my section by inviting you to stay connected with FDA. Please follow us on Twitter if you're not already doing so already at FDA Food. You can also follow Dr. Susan Main, the Director of FDA's Center for Food Safety and Applied Nutrition, at Dr. Main FDA Food. We have a Pinterest board at US FDA, and we're on Facebook at FDA. And as I mentioned before, our News for Educator e-newsletter is a great way to stay in touch with our updates. And we also have consumer updates and constituent updates that you may want to sign up for to stay in touch. So with that, I'll turn it back to Sheena, who will tell you how to stay in touch with AICR.
All right, so here we've updated a lot of our materials, specifically that pertaining to the nutrition facts label. We have a few new fact sheets for health educators to use in their patient and client education. So two of our newest fact sheets are AICR's tips on how to read the nutrition facts label and AICR's guide to healthy dining out. So these are two of several other fact sheets that are available. You can download all other fact sheets from our online store, which is listed there, store.aicr.org. So be sure to check those out. You can also continue to stay connected with AICR through our Facebook, LinkedIn, Twitter, and our Instagram. So you can see our handles here. We also have some great AICR publications, including our AICR e-news, our cancer research update, and our healthy recipes, which can all be accessed on our website.
And so Sheena, I can just cover this last slide. So, but in conclusion, I mean, we know for sure that consumers are looking for healthier options, and we know that food manufacturers are hearing that as well. And the industry really is, there's so much innovation that's going on right now. We know that producers want to develop healthier options, and also they want to be able to feature and make claims about those and differentiate themselves from competitors based on those healthier components, healthier features. And we want to support these innovations from our perspective as a public health agency and promoting healthier dietary choices. But these science-based regulations and transparent labels will make it easier for consumers to understand the information they have to make better choices for themselves and their families for their long-term health. And it also, as I mentioned, makes it easier and more practical for manufacturers to compete on some of these features. And so we'll turn it back over to you, Sheena, for questions. But I again, thank you for the opportunity to join today. I feel like with the nutrition facts label, also with menu labeling, so with these changes, this is a real opportunity for the public health community at large to take advantage of these major changes. So much work went in from FDA, but far beyond. Food manufacturers, also the public health community, to update these regulations. Now we want consumers to be able to make the best choices and to be able to use this information to the best of their ability to help reduce the burden of nutrition-related chronic disease. So we are resourced at FDA to help develop the resources, but we are not resourced to do the dissemination. And so we really ask for your assistance in helping to promote the resources, the ones that we have available, but also the ones that are forthcoming, to get the information that's needed to the people who need them. So with that, I think we'll move along and go to questions and answers.
Yeah, thank you all so much for that great information. I know very, very important to have and to get out there to the general public. So we have a few questions rolling in, so we'll go ahead and get to those. Our first question comes from Jody. She's asking, does the nutrition innovation strategy have an end date? And if so, when does the FDA anticipate on completing all of the elements associated with it?
So this is Claudine Kavanaugh, and the nutrition innovation strategy really does not have an end date. It's kind of evolving. We've identified the critical factors that we want to start working on. And as people, if you don't know, working in the government and making changes through regulations, all of this does take time, and some of the timing is out of our control. But we do get a lot of feedback and stuff, and I think that ultimately ends up with a better product, and our nutrition facts label is an example of that. So there really isn't an end date, but we've identified the major goals and we're working towards those. And I definitely see, as kind of science and different things change, I could see us adding on or doing different things.
And I'll just add, so many of the components are on their own timeline. So things like menu labeling, the nutrition facts label, we're further along. So so different things are at different stages. And so, and as Claudine mentioned, there could be additional things in the future. So, yeah, thanks for the question.
Yeah, thank you for clarifying that. Our next question is from Doris. She's asking, who is responsible for monitoring the accuracy of information that's posted by restaurants on menus, and whether it's posted at all on the menu?
So the FDA is ultimately responsible. Some states, though, are also enforcing menu labeling, so it somewhat depends on where you live. And then the ultimate responsibility goes to the restaurant and the establishment. And there are many different ways that they can determine what the calories are. They could use a database. They can use a chemical analysis. So there's different ways that they can determine what the calories are. The regulation gives them a lot of flexibility.
Great, thank you for that. Our next question is from Kayla. She's asking, going back to earlier in your presentation, what kind of scientific information is needed to show that fibers have a beneficial biological effect per the new dietary fiber definition?
So some of the things that we've looked at is, so some things would be, it could increase the absorption of key nutrients like calcium. It could also decrease satiety. It could lower cholesterol level, increase laxation. So it's a very broad range of what some of the beneficial effects are, and it's different from fiber to fiber. We've had some that show different things, but it does have to be some type of beneficial effect. We have a whole guidance document that outlines what some of those effects are, but there could be, I could envision there could be a novel fiber that may have a different effect, but as long as it's beneficial and they've demonstrated that it actually works, then it could be listed as a fiber.
Great, thank you. We have some great questions. Our next one is from Susan. She's wondering about the status of sodium reduction in the food supply and wants to know if you guys have any thoughts about including it in the menu labeling or other ways that you can further communicate that to the public.
So sodium is one of the nutrients that's required to be available on request as part of the menu labeling. So that's already there, and as noted, sodium reduction is part of the nutrition innovation strategy, and we've certainly committed to sodium reduction work, and in 2016 issued draft guidance for short and long-term targets to reduce sodium in about 150 categories of food. So with the goal of gradually and across the board slowly reducing sodium, given that it's an adaptive taste and works best and has worked in other countries to slowly reduce sodium intake. And it's something we've stated publicly that we're committed to finalizing the guidance on the short-term targets, and that's certainly still an agency priority.
Great, thank you. Our next question, if you could touch up a little bit more on how consumers are going to know if there's a new and updated nutrition facts label.
Well, this is Robin. I would say one of the biggest tells is a very large calorie size. So that is the very easiest way. It's gone from an 8-point font in a lot of cases in the standard label format, from 8-point to 22-point font. So you cannot miss that. As soon as you see the large calories, that's a new label.
Great. Yes, the new label does have a new and updated look, so hopefully people will continue to notice that. So now we're going to move to our last question here to wrap things up. This is from John. He's asking, do you use focus groups or other consumer testing methods to develop educational materials?
Great question from John. Hopefully you all can hear me. This is Maya. We absolutely use focus group testing. So for instance, in our nutrition facts label campaign materials, we use focus groups to help us select what would be the best concept or way to communicate this information to consumers. And then once we got a little farther along with actual materials, we used some testing to see how those materials were resonating, what messages people were getting, to help us refine the materials even further. So we try to involve consumers at every step of the development process when we're developing materials.
Wonderful. Thank you guys so much, Robin, Claudine, and Maya. We really appreciate you clarifying and answering questions. So we'll kind of wrap things up here and kind of conclude the Q&A portion. So I want to just say on behalf of AICR and FDA, we thank you for joining today's webinar on the updated nutrition facts label. Please note that shortly you will be receiving an email with a link to a survey and your CPEU certificate. Thank you guys so much, and I hope everyone has a wonderful day.